Hello, I'm Dr. Suparna Banerjee. I'm infertility specialist and gynecologist. Let's talk about polycystic ovary syndrome and diet. So, first, polycystic ovary syndrome, the main problem is insulin metabolism. So, insulin is the hormone which controls our blood sugar or carbohydrate metabolism. So, polycystic ovary, carbohydrate metabolism is at risk. That's why patients are very prone to develop diabetes. Weight gain is also very high. That leads to development of diabetes, heart disease, increased cholesterol, triglycerides, high blood pressure, etc. So, how to control it is a lifestyle management. So, there should be a balance of your exercise or day to day physical activity and your diet. So, if you are a very active person, you can have some allowance of carbohydrate. That should be a good carbohydrate. What is good carbohydrate? Which contains complex carbohydrate, more vitamin, mineral, and more fiber. That is fruit carbohydrate, legumes or lentil like things like this carbohydrates. So if you name it, everything has got some amount of carbohydrates. Some are good carbohydrates, some are not that good carbohydrate. What you want to avoid at any cost is the fried food or refined carbohydrate, bad kind of fat, which is kind of oil or sometimes we say cheese is bad for your health. If you say yes on pizza, we are saying bad food. It's a fast food, bad food. Why? Contain carbohydrate, lot of cheese, but still cheese. If you intake a little amount of cheese, that is not harmful. So I'm not saying you take pizza, but if somebody wants to have butter or cheese, though they are fat, but a little amount of that is also good because that contains so many minerals and vitamin, fat soluble vitamin, that is helpful for your health. But again, amount is very important. How much you are taking? Full fat milk, yes, that is good, and nowadays we are saying that is better than your skimmed milk or toned milk, because with this toning process we lose some of the vitamins from milk. So full fat milk in that way is better. But again, the amount, you should not take a huge amount. Little bit of milk or cheese or dairy product is very good, which kind of a full fat. Okay. And like some, you might have crave for sweet. So I myself, I am a very sweet tooth person, but you have to control that what type of sweet you are taking and how much you are taking. So suppose I love chocolate. So if you really want to have chocolate, again a little amount of chocolate, and that is also dark chocolate, which should contain 70 to 80% cocoa. That is not bad for your health. Cocoa helps. It's an anti-inflammatory. It has got many minerals, and it can be helpful for your health. But again, the little amount of chocolate, if you take daily, but that is a dark chocolate, that is not bad. But normal chocolate with lot of sugar and bad fat is bad for our health if we take it regularly. In that case, any fizzy drink or any fried food, fast food, why they're bad? Because bad fat and loads of refined carbohydrates are there in. So at any cost, try to avoid it. Homemade cooked food is good, or uncooked food like salads and fruits, there is no alternative to it. And nuts and seeds are very important. If you want to have snack, or if you think, okay, I cannot control my hunger, I have to eat something, I want to nibble something, then probably best thing is nuts. Seeds and nuts are very good, gives you fullness, as well as multiple benefits of mineral, anti-inflammatory, multiple polyunsaturated fatty acid. Name it, like chia seed, pumpkin seed, very good. Your almond, the walnut, these are very good in their food value. If you say yes, it contains fat, it contains some amount of carbohydrate, but still it is good. Like banana, like dates, prune, all are little bit sugary, contain sugar, but fruit sugar is better than your like fizzy drink sugar, where just sugar cane sugar is added. So try to avoid those sugars. So you have to just think. what you are taking, how natural it is. So refined foods are bad, natural food like fruits, fruit sugar is better. So you're not restricting totally the sugar, but what type of sugar you are taking, that is important, how much you are taking, and what sort of person you are, how active you are. If you are a very active person, your carbohydrate allowance is much more than an inactive person who does not, mainly inactive means sedentary habit, you do not have much physical activity, so your need for carbohydrate is less, but a little bit of carbohydrate always required for our brain as well. Our brain will not function if we do not eat a little bit of carbohydrate at least, because carbohydrate gives us a instant energy. So when we feel hungry, tired, then if you take some carbohydrate, gives you instant energy, and protein and fat gives you a sustained energy. So both are required. So in combination, in balance, and depending on your lifestyle. So if you consult a dietitian, they can guide you more depending on what sort of person you are, what sort of activity, what sort of job you do, how in a 24-hour day, what is your daily activity accordingly. So everybody's diet cannot be same, and I cannot cover whole thing in this video. So different person, different activity, different job, their amount of carbohydrate, protein, fat requirements is different, and the food combination is different. But overall, you need to consider natural food like fruits, vegetable, and quinoa is another good thing which is kind of coming in our society. It is actually, you say quinoa, barley, those are better than our normal rice and wheat. So our prime minister is also, and India is promoting, and our prime minister is promoting the millet food. So these are super food. Quinoa, which is a South American food, that is also kind of a millet food. And we have ourselves has got this ragi, bajra, all millet food, and this barley. These are buckwheat. These are very good. They have carbohydrate, but these are complex carbohydrate, loads of fibers and minerals. So better than our normal, the flour, atta, maida. It is better than that. So complex carbohydrate, you if you consume that, it will be helpful in the long run for your health.